Doctors, have you had a stubborn patient make their condition worse? I was a nurse for 20 years, but this is a story about my husband. The man has a very high pain tolerance and is always hungry, so one day when I met him for lunch I was worried when he wouldn't eat and said his lower abdomen hurt. I talked to a doctor friend and husband was sent for an immediate CT scan. Husband was sent home to wait for the results. So being him felt better and ate 2 chili dogs with fritters. Of course when the doc called and told him to get to the hospital now because his appendix was about to rupture, husband had to be kept in a holding pattern for 12 hours because he'd eaten a big meal. I may have shouted at husband a little bit that day. I saw this young guy in the ER once who had gotten into a drunken brawl with some guys at a bar. When he woke up the next morning, he started getting some vision changes. He said that it was like a black sheet coming down on his left eye. This is a textbook symptom for retinal detachment. Picture an incredibly thin delicate membrane on the back of the eye, slowly peeling off because of trauma. It's an emergency in ophthalmology because if it fully detaches, you get permanent vision loss. You basically need to immediately go for surgical repair and then be extremely careful with that eye for weeks afterward. You even have to keep your head down most of the time for the next couple days to help the reattachment process take. So, naturally this guy goes and rides roller coasters all day at the local theme park with his buddies. He first presented to our ER 2 days later with permanent vision loss in that eye. Six Flags was not worth it, poor guy. I used to work at an oral surgeon's office. A patient came in needing a tooth pulled, and the root was near the jaw. They needed to remove it under anesthesia. The patient did not want to pay for the anesthesia, $350, so he decided to try and take it out on his own. He used pliers, ended up breaking his jaw. We had to go and fix his jaw and wire his mouth shut. Ended up costing him $9,000 instead of $500. I'm a tech. This fairly large woman came into our unit with type 2 diabetes and diabetic ulcers all over her lower legs, toe amputations, and a wound that would not heal. Her husband frequently visited her, and just before my shift brought her 6 tubs of the chocolate Pillsbury frosting icing because of her sweet tooth, and they have insulin at the hospital to match the sugar. When I stopped to check on her, she had already finished tub #4 and said to me, "But I'm already at the hospital, I might as well." SMH, yeah lady, no one ever dies at the hospital. I had a client with a stroke who received TENS treatment in rehabilitation, really low electric impulse, to stimulate muscles and nerves. After rehabilitation he was offered to get one of the things for home use, completely free of charge costs. He refuses because filling out the paper, 1 page, was too much work. He decided to just use what he had at home and tried using a transformator/transistor for this therapy. That completely destroyed the small amount of nerval function we had archived in rehabilitation and screwed up his condition a lot. Do not try this. This hurts a lot. Not a doctor or a nurse. Just the niece of a man that, after having a surgery performed on his gut and being told not to eat anything for the next 24 hours, decided to get chili cheese fries at Wendy's on his way home from the hospital. He went right back and his condition worsened. Also, my fiance's mother is a nurse and told us that a man came in once with a tiny garter snake up his urethra. It had been there for weeks before he came in because he was too embarrassed to admit he let the snake go exploring on purpose before it got stuck and died inside of him, so he promptly died of septicemia. Male patient was in for dehydration and other very routine issues. He had an indwelling catheter placed. Now an odd thing about some men is that they cannot wrap their minds around not standing up to pee. So even though he couldn't feel any urge to urinate, he stood up to pee, felt the catheter, forgot why it was there, and promptly ripped it out. Now has incontinent. Another patient was in recovering from surgery. I think it was knee/ankle. Something that required she use a walker while recovering. She decided not to do that and test her leg. She fell onto the tile floor and broke her hip. Not a doctor, but I had a stress fracture in my foot that had to be surgically corrected. I was given a 60-day supply of Vicodin, but my now ex-husband was a recovering alcoholic who had me convinced that I was going to become horribly addicted if I took them for more than a couple days. So I began taking Aleve because it was stronger than Tylenol and I only had to take one a day. My foot was very slow to heal. Like a couple months go by instead of the usual 6 weeks. I had to get a CT scan and I was very worried because this small little fracture just wasn't healing. My doctor asked what I was doing for pain and I told him about the Aleve. Turns out NSAIDs interfere with bone healing. I cut out the Aleve and my foot healed a few weeks later. Not a doctor, but my sister and I go ex-Mars shopping. She's newly pregnant. I can tell she's in pain and it's getting worse. She claims it's just gas. She thinks all stomach pain is gas. I offer to take both cards to check out while she sits for a bit. At this point she's vomiting. I'm pretty worried and tell her I think we need to go to the hospital. She insisted it was gas and she had a doctor's appointment the next day, so she'd mention it. Next day, she has ultrasound before OB appointment 5 minutes and she calls me and says she doesn't know what's happening, but they told her to get dressed and not to move. She hears them call an ambulance. Ruptured ectopic pregnancy with internal bleeding. She's fine though. Ended up pregnant again 2 months later with my nephew. But she still doesn't learn. After weeks of her sick and looking like death, I convinced her to go to her doctor last week. She has pneumonia. Nursing student here. Female patient had an indwelling catheter to help void her urine. She had fluid overload from heart failure. I was at the nursing station giving my co-sig nurse a report when I saw my patient walk up to us and start speaking to us in Greek. It took me about 2 seconds to realize that she didn't have her walker with her. Another 2 seconds to notice she didn't have her catheter with her either. I walked her back to bed and saw the catheter attached to her bedpost with a balloon still fully inflated. It was certainly a self-inflicted condition. Old guy in for a hab after some kind of orthopedic surgery, taking warfarin for DVT prophylaxis. His INR, a clotting time test basically, was coming back out of whack time after time despite dose adjustments and nobody could really figure it out. Went in his room on some routine task and saw a large pill bottle on the dresser. Turned out to be an herbal supplement containing, among other things, garlic, ginger, and IIRC ginseng. All of which interact with warfarin to make it more effective. Guy's wife took pills home. Guy lectured on please run even OTC meds past your doctor cause you absolutely did this to yourself. Labs normalized. Obligatory not a doctor. I'm an optician and optometrist, and so many semi-blind people refuse to get glasses because they don't want to spoil their eyes. They come back 6 months later with migraines and complain about not being able to drive in the dark or read and get angry because their eyesight is not getting better, although they are always training their eyes. It doesn't work like that. Nurse here. The condition was not worsened by the patient himself, but his choice of life partner certainly did not help. Patient was utterly ravaged by advanced cancer. Several doctors have told him and his wife that his condition is terminal. Patient seemed to understand when he was lucid. Wife said she understood as well. He was in hospice for comfort. One night he had trouble breathing, as the dying tend to do. Wife called 911 against patient's wishes. Thus began a 3-week pointless and painful ordeal that involved life support, dialysis, at least 1 round of CPR on a man whose bones were riddled with metastasis and diarrhea. Wife was adamant that he will get better through holistic medicine. On top of being in denial, she was dumber than dirt. She filled the intensive care room with all sorts of new age shots like inspirational pictures and rocks. She even refused pain medicine because it would, like, dim his chakras. Wife left a crystal geode on the bed. Crystal worked its way underneath patient's hip. Patient developed a raging bed sore that never closed, was nearly always soaked in feces, and was a bitch to dress. On a patient who wanted to die and was in already excruciating pain. This was years ago. Still, I can honestly say I hate that woman. Had a patient come in and had accidentally stuck a chainsaw in his leg the day before. He managed to cut the fibula I think, and partially cut the tibia. He put some diesel on it and wrapped it in duct tape and kept working. The next day he steps off something and it snaps the rest of the way through. Came in the front door with his leg flopping / bending where it shouldn't be. And to top it off he rated his pain at 6/10. Tough old man. We admitted him to ortho to clean out the diesel and necrotic flesh. If my doctor was here they'd say me. I put up with appendicitis for 5-6 days before going to a doctor. I couldn't eat or sleep, was in constant pain, vomited multiple times an hour, but just thought I was ill and be fine in a couple of days. Long story short, I went into cardiac arrest as it exploded mid-surgery. I shouldn't have even been operated on, but a slot opened up. If not for that I would have died in my hospital bed. So yeah, pretty much killed myself cause I thought I'd be fine. Had to spend a week in hospital for a routine operation. When I was on medicine wards in med school we had a patient with a Zenker's diverticulum. It's essentially a weak spot as his esophagus kinda makes an outpouching where food and liquid get stuck. He can then regurgitate the food and aspirate leading to pneumonia and other bad stuff. We were the primary team and Serg was going to take him back to the OR on Friday. Thursday night he eloped and no one knew where he went. He came back Monday to the ED and got readmitted. When we asked where he went he said there was a big food festival that weekend that he didn't want to miss, so he went. Instead of getting the surgery he needed he left to go eat fatty and thick fried foods which literally could have killed him. I had a patient that came in with breast cancer to the hospital. She was Middle Eastern. Forgive me, I don't remember exactly where from. I just remember she was wearing a hijab, had a 3-year-old kid, and was in the middle of a divorce. Her cancer was not very advanced. She was recently diagnosed. When my ER doctor asked her what treatment she was getting for the cancer, she said she was doing alternative medicine, basically some sort of antioxidant tea and homeopathic medicines. He looked her in the eye and flat out told her alternative medicine is not going to help. You're going to die if you don't get surgery or chemotherapy or what an oncologist recommends. Look at your 3-year-old and think he will be left without a mother because you'll be dead in a few years if you don't get treated with Western medicine. I think no one had told her this flat out in those words because the look of horror in her face and her immediately agreeing to an oncologist consult in the hospital said it all. I still think there might have been better ways for him to tell her all this, but in the end he might have saved her life by being so forward. Not stupid, but just plain confused. Grandpa admitted for pelvic distension, pyelonephritis and duty secondary to urinary retention. Urologist places a Farley catheter in to relieve his bladder and drains 3 gallons of urine in one sitting. Grandpa gets a good day's rest and all goes well until one night we find him standing, but naked in the middle of his room with his penis oozing a pool of blood at his feet and the catheter, with the balloon still inflated, clutched in his fist. He had a very calm "what are you all looking at?" expression as we reacted in horror. His nurse quickly calls the urologist again, and he places another Farley catheter with orders for continuous irrigation and to transfuse a unit of blood. Kept him longer in the hospital than he really needed to be. My mom's current BF has oral and throat cancer. Guy literally has a stoma and no tongue. Was still smoking around 3 packs a day until recently. Mother-in-law got diagnosed stage 3 lung cancer, quit smoking and drinking for a couple of months. As soon as doctor said her condition was improving she went straight back to smoking and partying. Only took a few months for the cancer to get to stage 4 and spread to her liver, kidneys, and brain. She smoked up until a couple days before she died, and even then, only because the brain cancer caused her to lose control of her limbs, and she physically couldn't hold a cigarette anymore. It was so sad to watch. I'm incredibly proud of my husband though. He quit smoking with her to help support her and never started again even after she did. Said he never wants her girls to have to go through that with him. Not a nurse, but close. I'm a therapeutic radiographer. Use radiation to treat cancers. We tell patients to be careful with what products they use on their skin because it can react with the radiation and give awful side effects. We had this one patient who was a total hippie, probably would be an anti-vaxxer if we were in America. Anyways, she was having breast treatment, and within a couple weeks we had noticed her skin getting really burned and breaking. We asked her whether she was using anything on her skin. Right at the beginning we told her only to use simple moisturizers and to ask us if she wanted to use anything else. She was like, "I'm glad you asked." She pulled a pamphlet out from her bag that was about this miracle oil that supposedly treats cancer. She had been slathering it on every day, and because of this the radiation was making her skin literally fall off. We told her to stop using this immediately, and that if she wanted to use it, she'd have to wait until after treatment. She got all heated and started telling us we were a product of the system and we didn't want her to actually be cured of cancer by this oil because then we'd be out of a job. She stormed out. The next day we saw her handing out these pamphlets to every patient that walked into the department. She was refusing to continue with her radiotherapy, claiming that we were only harming her and the oil will cure her. We had to get security to escort her out and get a doctor to sit down and talk to her. We then had to take the pamphlets back from our patients and give a big sad as to why what she was saying was bullshit. We never saw her again. Like and subscribe for more Reddit videos.